And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am Dr. Sherita Gaskins-Tillett. I am your host. Level Up Live is the show where we highlight the amazing accomplishments of women physicians, both inside and outside of the exam room. I am really excited about tonight's guest. She is a wealth of information. I can't wait to share her with you. I just want to allow a few more minutes for people to jump on. If you're joining us live, please say hello in the comments. If you have questions, please write your questions in the comments and we will answer them. If you are watching the replay, hashtag replay. And I would still invite you to leave your questions in the comment section because I will pass those on to our guest and try to get them answered for you. And just by way of reminder, just wanted to remind you that registration is open for a weekend for me, our fall retreat, the premier wellness experience for professional women. It's taking place in Puerto Rico, November 2nd through 5th. So please register today, www.aweekendforme.com. Early bird pricing is available until August 18th. So you have just a little over 2 weeks to get that early bird pricing, and it is amazing. So we can't wait. I'm so excited about it, and I hope you can join us. So I'm excited to introduce our guest tonight. Our guest is Dr. Vivian Asamoah. She is an integrative functional gastroenterologist and the owner, founder, and medical director of the Houston Gastro Institute. She is board certified in gastroenterology, hepatology, and nutrition. She completed her residency at Johns Hopkins Bayview Medical Center and went on to complete her fellowship at the Johns Hopkins University Hospital in Baltimore. She completed certification in functional medicine through the Institute for Functional Medicine. Dr. Vivian is an international speaker, educator, and patient advocate. She lectures extensively on gastrointestinal disorders, including microbiome imbalance, food intolerance sensitivities, and gut-brain axis disorders. Dr. Vivian uses a multidisciplinary root cause approach to healing chronic gastro disorders using food first. In collaboration with functional dietitians, nutritionists, and health coaches, she has developed 6-week nutrition group programs focused on incorporating therapeutic food plans. She also has a personalized telehealth signature program focused on integrative approaches to managing chronic gastrointestinal conditions. Dr. Vivian also leads a Facebook community and YouTube channel called Natural Gut Relief, where she hosts weekly lives with prominent speakers as a reliable resource for information on gut health and wellness. Welcome, Dr. Vivian.
Thank you so much. Thank you, Dr. Gaskins. Thank you for having me on today. It's a
Thank
pleasure
you
to
for
be here.
coming. I'm happy to have you. I just want to say hi to our friends in the comments, Dr. Tawana, Dr. Judy. Good to see you guys. Um,
Guys.
so let's jump right in. Tell us a little bit about your journey through medicine. Did you always want to be a physician? And how did you end up a gastroenterologist?
Oh my goodness, that's such a great question. And unfortunately, my answer is so boring. It is boring. It is really boring. I think, no, I didn't know what I wanted to do because I actually went to finish high school in Europe. And we went, you go straight to university there. And I really wasn't sure. I was interested in so many things. So my old wise father said, medicine it shall be. I'm an African girl, a Ghanaian. So it's usually just medicine, engineering, or accounting or something.
Right.
And I said, okay, that sounds like I can do it. I love the sciences, but I also love languages. So it was very, very hard for me to do. And I think, like a lot of things in my life, I have somewhat been led. I feel like I've been led by a higher power in some ways, always guiding and directing me in the right way. So it was medicine. I got in pretty quickly, did medicine, loved it. Really enjoyed the connection with patient care. And I said, I think this is really my thing. Sometimes daddy knows best, right?
Yes. Sometimes.
Sometimes. And then with gastroenterology, it was the same thing. I was in second year residency, which is when we start having, you start having to pick, do you want to do family medicine, internal medicine? Do you want to do a
Sure.
specialty? And I was like, you know what? I don't know. I love so many different parts of medicine. I was like, I want to do infectious disease, public health. I was all over the place. And then I had a mentor, and mentors are wonderful people because sometimes they see something in you that you don't see for yourself. And I had a wonderful mentor who was a gastroenterologist and liver specialist and said, you're going to do gastroenterology. And I was like, really? And they were like, yes, we think you'd be a great fit. And they offered me the spot in the fellowship, and that was that. And I did it, and I loved it.
Wow.
So I kind of
okay. So that sounds like a relatively easy path without a lot of angst.
Yes, relatively.
All right. So now tell us about the integrative part, because now you've incorporated integrative medicine into your practice of gastroenterology. When did you develop this interest, and tell us how how those two fit together?
Yeah. So that's a great question. In searching, I thought, what happened when I was actually an attending and started working. But in hindsight and digging a little bit deeper, I realized that interest must have been there since childhood because my mom was very much into herbs and very much into natural medicine and really tried avoiding using prescription medicine with us. So she would always be in the kitchen concocting some herbs from her garden. And, she had this big Bible called God's Garden where she had like all these herbs and what they did and used dandelion for this and this. And as Africans, we do a lot of traditional medicine. So she kind of combined the two. So I think that had always been part of my core. And nutrition was a special interest when I started fellowship as a gastroenterologist. Integrative medicine, I started practicing and noticed food really mattered. So then I said, let's take it a little bit deeper. Let me learn a little more.
I see. Okay.
Yeah.
So now you seem to have more of a focus on overall gut health. Just I follow your Facebook group and your YouTube. Overall gut health. And so for our audience sake, tell us what gut health is first. Let's start with that.
Yeah, so that's a huge question. When you asked me that before, I was like, I don't even know. Gut health is almost like saying, what is good health, right? What is good health, right? It's like, it is so interesting that in the last 10 years, I would say we're hearing so much more about gut health, right? I don't think we've heard as much about it because we're realizing how important the gut is. And that's why I think it's almost like saying good health because, 70% of our immune system is in the gut. So if your gut is off, your immune system, and Dr. Gaskins, we noticed this when people had a lot of GI symptoms, they had a lot of gut symptoms afterwards, and it was hard to recover, right? So we also know that gut is the place that houses most of the microbiome in our system. And this microbiome, which are all the healthy bacteria that help us live in sync with our body, is in the gut, right? So if your gut health is not good, that is also affected. And then they say you are what you eat, right? So anything we put in our bodies, processed foods, drinking things like soda, drinking things that have a lot of antibiotics or pesticides will affect the gut health as well. So when we talk about gut health, I think we're really talking about, as a gastroenterologist, overall health, right? It affects so many other things. And gut health is really finding that balance. Eating, how your gut is working, how you're feeding your gut, and how your gut is responding to that.
Yeah, you mentioned about the immune system, but I also recall reading about the amount of neurotransmitters that are in the gut. I believe there are more neurotransmitters in the gut than there actually are in the brain.
Absolutely.
And so that was astounding to me.
Yes, absolutely. So I mean, the gut is more important than the brain, more important than
right. In terms of, just in terms of our overall health and our mood, and because if the implications of that in my mind would be, if we're able to maximize our gut health, then perhaps people won't need as many antidepressants and other things.
Absolutely, 100%, Dr. Gaskins, you're right on. They're talking about how gut health even affects children with ADHD,
Oh, wow.
people who have autism or suffer from different spectrums, who are on the spectrum for autism, depression, anxiety, right? And now we're really trying to figure out, is it the chicken or the egg? Is it the gut issue that's causing this, or is it the underlying neurotransmitter issue that's causing the gut issue? So I think some
Ah,
very
okay.
important discovery are happening, but we're seeing that even some of our patients with schizophrenia are getting better response to their medication when their gut health is better. And
Okay.
we are also seeing that some patients, even looking at colon cancer right now, are getting better response to immunity and chemotherapy. Gut health is better.
Wow. Okay.
So
So then my next question has got to be, how do we get our gut health better? Because you're
that's a
telling us
great
all these
question.
wonderful things that happen for us. So tell us, how do we get our gut health better?
So when it's basic, it's easy to all to understand, and it's easy to implement. So many complex diets out there right now that I think a lot of people come to us. I think if you start off with the basics of looking at and moving what is potential, which I would say one is processed foods. Eating out a lot, eating from things that are packaged. So anything that has a shelf life of a year be good for you, right? It's probably filled with things that are not healthy for you. So avoiding the process and just starting off with cooking at home more often, right? Adding more fruits and vegetables to your meals, to every meal, and making that intentional. Drinking more water, eating without rushing, 10-minute meals, like really taking your time to set the table, sit at the table, and have that mindful eating so you can experience mindful digestion. Drinking water, staying away from soda and high fructose syrup things. I think, and then just getting that pattern of regularity in your meals. I think those are the basics that we can all start off with that really help improve gut health.
Okay. So now, are there things that we should absolutely avoid always?
Um, yeah, for sure. I think you avoid fast food and processed food as much as you possibly can, right? That's not, and the second one I think is pretty, that we really don't have to do. So it
Okay.
contains 30 grams of sugar in it that we don't need. And a lot of high fructose corn syrup is that sugar that I've seen liver disease, right? The high corn syrup, which is in soda, is the number one cause of fatty liver disease. And fatty liver is the number one cause of chronic liver problems
Mm,
like cirrhosis, and the
right.
number one cause of liver transplants. So we're seeing kids start drinking soda like when they're two. And
Yeah.
so yeah, right. You see them like with a huge 16 ounce, and we're seeing them drink this soda all the way till they're 20, 30. So by the time I see them in clinic, they've already got fatty liver. They've already
Wow.
got cholesterol issues, insulin issues, and their liver is already scarring because, I mean, as a kid, I'm in my mid 40s. As a kid, I usually drank soda on special holidays.
Right.
Like it's Christmas, it's birthday, it's a party. But now it's like every day.
I mean, that's the same with the fast food too. I tell my daughter that it was a treat when we had fast
True.
food. It was very rare. It was not a weekly, certainly not daily, not even
Right.
weekly, maybe not even monthly occurrence.
I
And
agree
now
with
it
you.
seems, it's pretty big. But I think, you bring out a huge point because as parents, you don't think about the implications of the soda. We think about it in terms of the sugar and
Yeah.
in terms of weight and maybe even inducing some hyperactivity. But this is the first I'm hearing about its impact on the liver and
Yes.
long-term disease in that respect.
Absolutely. And long-term disease, chronic disease happening early, right? So it's happening in young adults who are like 30s and 40s, and we're like, oh, your liver's cirrhotic, you've got scarring in the liver, and we're looking at long-term complications here, and you potentially needing a liver transplant. And I think the biggest thing is that this could have been reversed. It's reversible, like it could have been prevented, right?
Yeah.
This is definitely preventable disease. Yeah.
So you talked about some of the things that we should avoid eating. What about supplements? I know I hear a lot about probiotics and prebiotics and those kinds of things. Talk to us a little bit about the supplements.
So in the world of integrative and functional medicine, we do focus quite heavily on understanding what the body needs in terms of nutrients. And the reason behind this is because we are genetically all very different. And this vitamin B12, another person. Number two, our food and our soil is definitely stripped of a lot of nutrients today, right? The soil is not rich soil. From an agricultural standpoint, we're just, it's mass production, right? A lot of these crops. So
Yeah.
it doesn't have that richness in terms of trace elements that we used to have, right? And so you start noticing that a heavy percentage of our population are magnesium deficient. You wonder why, but it's really because we're deficient in a lot of trace elements. So that's an important one. We're just not eating the right food. So omega levels, omega EPAs and DHAs, omega fish oils tend to be low. Extreme supplement in preventing inflammation. I remember as a kid, my mom gave us cod liver oil every day. And I was like, I hate this.
Little did you know, right? It served a purpose.
I know that I would start taking it myself as an adult every day. So yeah, so there was a reason behind that, right? There was a reason behind that. And vitamin D deficient, depleted in so many, right? Reasons why could be what we're eating, exposure to sun, it's not using the right way in our systems. Supplements that I recommend, believe that it's a one size fits all. So it's really important to kind of know where your nutrient levels are and what you need in terms of your overall health, right? Whether you have high blood pressure or diabetes, there are different supplements that have been shown to help improve certain conditions, right? And all of this important to take under guidance of your doctor or someone who is, a physician who is well experienced, who understands it and can blend it with what you're doing from a conventional standpoint. Because at the end of the day, Dr. Gaskins, a lot of patients are taking supplements.
Yes.
Just don't tell their doctors about it because they feel their more conventional doctors are just not going to take them seriously.
Right.
And go ahead.
I do think that more doctors, though, are recognizing the importance of an integrative approach.
Absolutely.
Learning the individual patient and making more of a tailored treatment plan.
Absolutely. And that's good. I think that gets us a buy-in in terms of partnership and care with the patient.
So we do have a question from the audience. Do you have a recommendation for cod liver oil supplement?
So yes, I mean, I use the one that I'll share. The one that I use a company called Biotics Research. I use them for two reasons. One, they're local. They're a supplement company here in Houston, probably about 20 minutes from me. I have been to the plant. I have seen the way the supplements are actually manufactured, and they source their fish oil from very clean sources, and they have very high doses of omega. So that's the company that I use. You can find them online. They're called Biotics Research, and the dose that you want overall is about 2.5 grams. And sometimes when we're treating inflammation, patients with chronic inflammation will go up to as high as 5 to even 6 grams, depending on what the needs are.
Okay. And so you said 2 to 2.5 grams. Is it measured in a cup? Like, how would you know?
Oh, it usually says it right on the bottle. So if it's a good supplement company, you'll see the dosing.
Okay. So it'll tell you like how many teaspoons.
It'll tell you, yeah. So now, we take fish oil in capsules. It exists in capsules, yeah.
Oh, okay. All right. Very good. Yeah. You can tell I don't take fish oil supplements. So I do want to ask about food allergies.
Yes.
because, over 20 million people in the US have food allergies. And we were talking a little bit before we came on air, and I was saying, at least anecdotally, it seems to me that there are a lot more people with food allergies than when I was a child and what I can recall. Can you talk a little bit about food allergies and what if they are more prominent than they used to be? And if so, what's causing it? What can we do about it?
Yeah, so I generally don't see a lot of food allergies starting off. So if I'm going to be speaking, it will be from personal experience. My son has food allergies,
Ah,
and he has a peanut allergy as well as an egg allergy that we discovered when he was around 1. So food allergies will pop up in childhood, infancy to childhood. So they're usually already recognized by the time I see patients and as an adult. I do agree with you that there seems to be a lot more um, food allergies. We're detecting it more. And I don't know whether it has something to do when foods are introduced, whether it has something to do with the overall environment and cross reactivity between plants or, trees and crops. I don't know the exact science. And I think an allergist would probably be able to give you a
sure.
lot more information. But as an adult, a gastroenterologist, I am seeing a lot more food sensitivities. And food sensitivities are very different to food allergies. Food allergies are, generally you eat the food and within an hour to 2 hours, you're presenting with some kind of anaphylactic reaction, like nausea, vomiting, diarrhea, hives, breathing issues, and then eventually shock, right? And within 1 to 2 hours. So they are not delayed, they're immediate. But food sensitivities are like you eat something and it could take even till the next day where you feel stomach grumbling, bloating, or even like some nasal drainage, like there's some kind of reaction going on.
Yeah.
And very often that's really tough because you don't know which food you ate the day before,
Yes.
3 days before. That's why it's so difficult. It's also super hard because there's no perfect test for food sensitivities. Gluten is a common one. Wheat sensitivities are common, clearly defined, even in people who don't have true celiac disease, which is like the true, immune response to gluten. And dairy is another one where people can be sensitive to the protein or actually just lactose intolerant. So we are seeing food sensitivities more often, and I think it's probably because of what we're eating, processed foods and microbiome issues and stuff. Yeah.
Okay. So now, tell us how you would approach some of the more common, as an integrative gastroenterologist, some of the more common things that we see in gastroenterology or our GI upset. So things like gastro esophageal reflux or GERD or what's the other one I was thinking about? Oh, IBS, irritable bowel. So
Yes.
what's your approach to people that come in with those things?
Yeah, so that's a great question, and the approach really in our practice is very personalized and very customized. Everybody's IBS is so different, and we've noticed that a cookie cutter approach doesn't usually give the right same results for everyone. But we always start with food first, and I think this is important not just for a gastroenterologist but any physician practice. What are you eating? What do you eat? So we start off with a recall, really trying to get the patient to you know see if there's any connection between what they ate and their symptoms. And one question that I always ask, and I think my patients remember me, I always say, if you had to rate your diet from an A to an F, an A being you grow your own garden and you're out there, from the roots, cooking every day and baking your own sourdough bread. And an F is you are sleeping at the door of Whataburger, waiting for them to open every morning. Where would you place yourself? And patients often giggle. They giggle, but they're like, you know what, doc? I think I'm at a C minus or a C plus. And I'm like,
Okay.
you're just passing. So it just really gives them a chance to really kind of get some perspective on what they're doing in terms of their diet and how their diet could be impacting. I think that's the first place to start, is really doing a food recall. So then we start with education about, well, this is great. This we can do better. This is different. And then, as we are an integrative practice, a lot of patients come to us and don't want prescription or have been on prescription for a long time and they're trying to get off it. So, for us, as we blend the best of both worlds, We want to figure, we don't say, if your leg is broken, do you want turmeric or do you want an orthopedic surgeon? You want
Right.
an orthopedic surgeon, right?
Sure.
So
Sure.
we really try and assess if this patient has been properly evaluated with all the right tests to figure out, you know, whoa, is this
We still see
still
you.
there? Oh, okay.
You're still there for us. I think your
Right.
signal might be
Yeah.
a little
Is
choppy,
Yeah, maybe.
but I still hear and see
You
you
still
fine.
see me? Perfect. Is this acid reflux or is this not acid reflux? Does this person have risk factors like family history of cancer? Do they need to be on a prescription medication? If we feel that's not the case, we work with diet and we look at some natural supplements that are known to help with acid reflux, like DGL, which is deglycerinated licorice, ginger. We use seaweed alginate, helps a lot. It's kind of like the natural version of Malox or Gaviscon, seaweed alginate. We use digestive enzymes, to help digest better, so it gets the acid out of the stomach. We figure out if it's an acid issue or not an acid issue, because sometimes reflux is caused by not enough acid. So a couple things that we do to see what really helps our patient, but I think we always start with food first.
Okay.
Yeah.
Wow. All right. How about lactose intolerance? We kind of touched on it a little bit, and I've
Yes.
heard you talk. I know you did was it 30-day challenge of no milk?
No milk, no dairy.
Tell
I
us
was
tell us a little bit about lactose intolerance. What did you find? So you're at least a study of one. What did you find
afraid
with
of one.
your absence, your milk free month?
Milk free. So I was about 70% compliant because sometimes I forgot.
Okay.
I forgot because there's dairy in everything.
Yes.
Every, I realized there's dairy in so many foods, right? So that was a big aha moment for me. Like, wow, you got to be careful. But I did find that I was less bloated. I was a lot less bloated when I had less dairy. I didn't think I had a dairy, like a lactose intolerance, because I don't really have like diarrhea and stuff. But I don't think lactose sits well in my gut. It just doesn't make me comfortable. So when I avoid dairy, I didn't have as much reflux and I wasn't as bloated. So that really helped. Yeah, that
Okay.
really helped.
So now what made you decide to do that? The 30-day
So
challenge.
the 30-day challenge we did in our Facebook group, is with the Natural Gut Relief Facebook group,
Yeah.
really to get people to understand the process of food elimination. Like, because when you go see a doctor and they're like, stop eating this, that, it's like, whoa, it's a lot. So as a group, we collectively decided to just avoid one food and see how it made you feel, kind of really being aware of, well, where are these food sources? Where do I find dairy? So it made people have to read labels, including myself, and then taking it off. What can I replace it with? Finding alternatives in terms of plant-based dairy and knowing that there's other stuff out there, right? And then where else do I get my sources of vitamin D? Because everyone thinks it's from dairy, but
Yeah.
it's not, right? And then how does it make me feel when I'm off it, right? And just really noticing if there's a difference. And that's the first step to behavior change, right? Taking it one step at a time and making one change at a time and seeing the benefit, and then you can move on to the next thing. I think it was helpful. Yeah, we did sugar last year, which was great.
A sugar-free month?
No, 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 no.
Oh,
10
I
days.
was gonna say that's almost impossible.
10 days.
Okay.
Yeah.
Wow. And what did you find from that one?
Well, we all lost weight.
Okay.
We all lost weight. We all lost weight. I think that was the first thing. And most of us had more energy, less mood swings, right? Yeah.
Mm-hmm.
But the biggest
That,
thing I
that, that's interesting that you mentioned the weight, because I know for years we were led to believe that it was fat that caused weight gain. And I
absolutely,
know now we're moving in the direction of understanding really that it's sugar.
yes, it is. It is. I think we were misled for
Yes.
many years. I mean, even the dietitians, conventional dietitians, we were all misled. And I think now we have a much better understanding, which is good.
So, speaking of weight loss, Dr. Tawana had another question for you. What are your thoughts on how weight loss is affected after colectomy?
That's an interesting question. So, is it more difficult to lose weight after you've had a total colectomy? I'm not sure I have the answer to that. I guess part of it would depend on why you had the colectomy in the first place, what was going on, what was the root cause. But I would say also that the colon is, and how much was removed. If it was all of it, you're not reabsorbing water. There could be some hormonal changes in terms of even how you metabolize and clear, detoxify your system. Ulcerative colitis was the cause, yes. So ulcerative colitis is an inflammatory condition, certainly. Autoimmune condition. So always think one autoimmune issue, there could be another one. You know, you want to make sure there's no other thyroid condition or hormonal issue that could be autoimmune related. But I don't know if there's any real evidence on this is what happens to your weight after you have a total colectomy. If someone has ulcerative colitis and has to get a colectomy, they're usually very sick before they get to that point, and which means they've lost a ton of weight, a ton of bleeding, a ton of diarrhea. And when they get it done, the body now has time to rest and, you know, and recover. And they usually start gaining weight once the inflammation is down. So I guess it would probably depend.
Okay. All right. Well, we are just about out of time. Tell us if people are interested in working with you, where can they find you? Tell us all the different places and all the different ways, because I read your bio and it sounds like there's a lot of different ways to connect with you.
Yeah, so my practice, thanks for that, Dr. Gaskins-Tillett. My practice is in Houston. So we are in Houston. That's our brick and mortar practice in Houston. We see general gastroenterology. And then for some patients, we open up for integrative functional gastroenterology. And these patients are seen more in a program that we've developed. And we've now developed 3 programs. And these, very often, these are more complex GI cases. But I am on social media. So I'm on YouTube, I'm on Facebook, and I'm also on Instagram under drvivianasamoah.com. And we have a private Facebook group called Natural Gut Relief on Facebook, where you can just join. And we have weekly lives and very often blogs and discussions and challenges going on every week. We have an upcoming masterclass this next week, Sunday, on cracking the code for GERD and really understanding the root cause behind GERD and natural solutions to resolve that. So I can share the link for the masterclasses if anyone is interested.
Yeah, please. We'll make sure that we put it in the comments
Okay.
so that people can join. You also, now you didn't mention telehealth, but I remember reading about telehealth. Um, is that
Yeah,
another way?
that is a lot of our integrative functional, actually 100% of our integrative functional gastro programs are all virtual telehealth. We see people across the globe. Yeah.
Okay.
Yeah.
Oh, across the globe. That was going to be my next question. Were they
Yeah.
restricted to Texas?
No, they're not.
Ah,
We
okay.
actually have clients in the Middle East and most recently a client in the United Kingdom who decided to actually physically now come to the United States to
Wow. To
see
see
us.
you guys? That's
Yes,
excellent.
yes,
They
yeah.
must have gotten tremendous results.
They did. And they're not our client anymore. They got fixed and they're all.
Oh, that's awesome. That's awesome. So you heard it, guys. No matter where you are, you can connect with Dr. Vivian and get your gut together.
Yes, I love
So,
that.
so I'd like to end on the same question or variation of the same question each week. And for this one, if there is one single best thing that we can do to uplevel our gut health, what would you recommend?
That's a hard question.
I gave you 30 minutes. No.
I know you did, and I thought I had it. Now I'm like, that one is not good. Uh,
Well,
one
some people cheat and give like a little list. So if you want to give
little,
a little list instead of just one, that's
let
okay
me
too.
see if I can give one thing. Ooh. I think that this isn't okay. It's gonna have to be 2. There's so
Okay.
many things, but I think that get your information from trusted sources when it comes to nutrition, right? The focus really is the evidence, the science is plant-based. Plant-based diet is what really brings nutrients to help feed seed and soil the gut and give you
Okay.
that gut health. So plant-based should be the focus, right? I know a lot of people are leaning towards keto and this and eating lots of meat, but truly plant-based is the way to go. Now, that doesn't mean you have to be vegetarian or vegan, but your diet has to be predominantly plant-based. Very true.
Okay.
That's number one. The second thing, and again, I'm ending with a tip from my mom, who's my mentor and guru, give up sugar.
Ah, okay.
If we all gave, I haven't done it. I want to do it. I've been talking about doing it. I love sweets. I love baking. I love cakes. But if I could give up sugar, I think it would just take everything to a different level. My
Yeah.
gut health, my energy, my focus, my hormone balance, so many things.
Wow. Well, unfortunately, in this country, we're addicted to sugar.
Completely. And salt.
Yeah, but definitely sugar. I think we were traveling out of the country, and my daughter asked for ketchup, and the ketchup tastes very different because it does not have the same sugar content.
That's right. We are totally hooked. Yeah.
All right, so there you have it, guys. We need to eliminate sugar. And what was the first one? I've forgotten already. What was the first one?
Go plant-based, more veggies and
Plant-based.
fruit.
That's right. I would have remembered that.
Yeah.
Plant-based and sugar. All right. Thank you so much, Dr. Vivian. You've been a wealth of information, as I knew you would be. Guys, follow her on Facebook, Natural Gut Relief. Lots of good information there. And again, this is we only just touched the surface of this topic, but just understand that your gut can affect almost all of your organ systems,
Yes.
and have a great impact on your overall health. So let's get that together. So take care. We will see you next week. Don't forget to register for the retreat, www.aweekendforme.com. Love to have you there. Take care. Bye-bye.
Bye. Thank you.
Thanks for joining, everybody.